everybody, welcome back to Dry Needling Academy for another wonderful episode about the scalene muscle. And again, another muscle that people are really nervous of because of where it sits as close as it is to the neurovascular bundle. There are three scalene muscles, and they are important for the lateral flexion of the neck as well as elevation of the first rib. The other thing about scalenes that people often forget is that it's an accessory breathing muscle. So for anybody who does not diaphragmatically breathe or breathes incorrectly or has shallow breathing, this is a very, very important muscle to check. So your scalenes are responsible for a multitude of issues because of where they lie close to the SCM. Also very, very popular for neck pain, dizziness, tinnitus, any of those balance issues. Always check those scalenes. Weightlifters, crossfitters, powerlifters, very, very prone to these muscle groups being affected. So I really encourage you to treat them. Be careful because of where they sit with the neurovascular bundle. But if you start getting brave and you read our book and you follow this instructional video, you're not going to have any issues at all.
With the patient lying supine, palpate the trigger points, which will be located between the attachment points of the SCM muscle, the clavicle itself, some of the trapezius, and be aware of the vascular regions such as the carotid artery and vein. Palpate deep and superficial across the whole region, looking for palpable bands. Once you have found that band, clean the area and the skin to make sure you don't have any chance of infection. Palpate and localize the trigger point with the index and middle finger. Place the applicator tube over the trigger point once you have trapped it. Tap the needle in very gently with a very short needle. Do not use a long needle. You will notice that the needle is placed at a posterior superior angle of approximately 45 degrees so as to avoid the apex of the lung. Also be aware of the carotid arteries. Do not come too close to those. Once you have placed the needle, you can start the actual needling technique, which will be a very gentle in and out fanning motion of not more than a couple of millimeters at a time.
This is Dr. Michelle Broadhurst saying goodbye to you today, and remember to like, follow, subscribe, and ring the bell if you'd like additional notifications about further episodes. And remember to check out Amazon for the new book that's just been released, which encompasses all of this and much, much more, which will help you immensely in getting really efficient and proficient in your dry needling. Have a wonderful day.